नमस्ते, मैं डॉक्टर प्रसाद कसबेकर, कंसल्टेंट कैंसर सर्जन एंड डायरेक्टर ऑफ सर्वस्व हेल्थ। आज हम बात करेंगे एक वेरी इंटरेस्टिंग कैंसर के ऊपर जिसका नाम है पैराथायरॉयड कैंसर। पैराथायरॉयड बेसिकली are four glands which are located behind your thyroid gland in the front part of your neck. इनका मेन फंक्शन है बॉडी का कैल्शियम मेटाबॉलिज्म। इनफैक्ट एक आदमी थायराइड ग्लैंड के बिना रह सकता है, बट पैराथायरॉयड ग्लैंड्स के बिना रहना इज ऑलमोस्ट फेटल। ये ग्लैंड बेसिकली प्रोड्यूसेस एन हार्मोन विच इज नोन एज पैराथायरॉयड हार्मोन, और इसका काम है बेसिकली कैल्शियम को ब्लड में लाना, यानी जो अपना कैल्शियम इंटेस्टाइन्स, किडनी और बेसिकली अपना बोन्स में है उसको वो ग्लैंड खींच के ब्लड में लाता है एंड वो कैल्शियम का ब्लड लेवल्स को मेंटेन करता है। In a normal person, the calcium level is between 9 to 11 milliequivalents, and the presence of parathyroid hormone increases that calcium level. So, in such cases when there is a parathyroid cancer or sometimes a benign condition known as parathyroid adenoma, वैसे कंडीशंस में अपना कैल्शियम 11 के ऊपर हो जाता है और उसके वजह से काफ़ी सिम्टम्स होते हैं विच आई विल टॉक अबाउट लेटर। सो फर्स्ट लेट अस टॉक अबाउट द रिस्क फैक्टर्स फॉर पैराथायरॉयड कैंसर्स। पैराथायरॉयड कैंसर बहुत ही रेयर है with an incidence of approximately 3 to 4 patients per 10 million cancer patients. However, parathyroid cancers are mainly seen in genetic conditions such as MEN syndrome or multiple endocrine neoplasia syndrome. Another syndrome is known as hyperparathyroidism jaw tumor syndrome, and the third syndrome in which it is commonly seen is just known as isolated hyperparathyroidism syndrome. उसके साथ साथ people with a history of radiation to the neck, especially as a part of cancer treatment, are at risk of developing parathyroid cancer in the later lives. It is more common a disease of elderly people जिनका एज बेसिकली 40 के ऊपर है, और दूसरा इट इज मोर कॉमन इन विमेन एज कम्पेयर टू मेन। सो व्हाट आर द साइंस एंड सिम्टम्स ऑफ पैराथायरॉयड कैंसर? Parathyroid cancer symptoms are basically a result of the increased calcium levels in your blood. Normally it is up to 11, but in cancer it can go as high as 14 also. This basically affects 4 organs in your body. Number 1 organ is your bone. So people with parathyroid cancer can feel more incidence of bone pain, increased risk of fractures, and weakness and lethargy. The second part is the kidneys. Increased calcium in the kidneys results in increased chances of kidney stones, increased thirst, and increased urination. The third organ affected is your gut or your intestine, resulting in constipation, loss of appetite, sometimes nausea and vomiting also. And the fourth organ affected is your brain, and that leads to lethargy, drowsiness, confusion, inability to concentrate, and all these non-specific symptoms. However, even the cancer itself can sometimes present as a lump in the throat and sometimes also cause changes in voice and other problems. So these are the basic symptoms of parathyroid cancer. So diagnosis and treatment of parathyroid cancers. The diagnosis basically is based on the serum calcium levels, the serum parathyroid hormone levels, and also for staging of the disease. So serum calcium levels give us an idea of the intensity of the parathyroid hormone influence. The parathyroid hormone levels usually is in the thousands and very highly elevated in cancer cases. Now, the important thing in imaging is we have to differentiate parathyroid cancer and parathyroid adenoma, which is the benign version. Usually that can be determined only after surgical removal, but sometimes we need to do scans such as local CT scan, MRIs, or even sometimes something known as a SESTA, maybe PET scan. This basically detects if this parathyroid cancer has spread to any other part of the body. Along with that, sometimes bone scans are also done to check for the integrity of the bones and how much calcification is present. Once we get a basic idea about the parathyroid lesion as well as its spread and other parameters, the main course of treatment is surgical removal. However, the important thing in these cancers is that we need to first stabilize the calcium levels. Otherwise, a lot of problems can happen post surgical removal of the parathyroid gland. There is something known as a hungry bone syndrome, where because of the excessive removal of calcium from the bone, the moment we do the surgery, the parathyroid hormone level falls. And in that scenario, suddenly the excess calcium in the blood gets resorbed or removed by the bones. And a person who's suffering from hypercalcemia or increased calcium levels goes to life-threatening hypocalcemia, where the calcium level falls way before its cutoff of 9. And that can lead to things like sudden cardiac arrests, severe neurological spasms, even seizures, and many more problems. So an important thing in parathyroid cancer is first controlling the systemic symptoms, and then we go ahead and do the surgery. Surgery is in form of removal of all the glands. Usually there are 4 glands, out of which in cancers 1 is affected. But we have to remove all for complete clearance and further treatments. Along with the gland, sometimes we might have removed the surrounding lymph nodes if the PET scan has shown spread to those structures as well. After surgery, lesser effective treatments are chemotherapy and radiation. These are not so effective in parathyroid cancers. However, many times giving chemotherapy can control the spread of the disease. One important fact is that majority of the glands of parathyroid which are enlarged and symptomatic usually are due to something known as parathyroid adenomas, which is not a cancer but a benign enlargement of the gland. In such cases, surgery is curative and patients can lead normal lives once their treatment is completed. After treatment, it is very important to keep a good follow-up of the patient. If the patient has cancer, then checking for distant metastasis as well as keeping the patient in control under chemotherapy and radiation is very effective. In benign cases as well as in cancer cases, the calcium metabolism coming back to normal takes a very long period of time. And in such cases, long-term calcium therapy and vitamin D3 therapy is given. So this in general is the entirety of a parathyroid cancer. If you have any questions regarding that, please feel free to contact me and I will be more than happy to answer them for you.